Hello everyone, I am Yash and we are here with another interesting and informative video for you. Today we will talk in detail about mastitis in cows. Have you ever wondered that cows can go through several diseases that can be curable and fatal too? It is a very important task for a cattle keeper to keep their cattle healthy and safe because it's not just going to affect their cattle health but will also affect their businesses and the quality of milk they deliver. In order to keep everything in check, you must be aware about basic symptoms, causes and the cure. So let's start with what actually mastitis is. Mastitis in cows is a disease that affects the udder area of a cow, that is, the area around the mammary gland. It is a sort of inflammatory disease caused due to the bodily abuse or bacterial infections. Mastitis in cows is caused by bacteria penetrating the teat tube. When a considerable white blood cell count moves into breast tissues, it is called mastitis. Majorly, the illnesses are driven by streptococci, gram-negative ROS, staphylococci, and particularly lactose-fermenting intestinal microbes known as coliforms. Now, as we are moving forward, we will discuss about types of mastitis in cows. The first one is subclinical mastitis. In this, the milk looks fine or there are no apparent signs of breast gland infection. A rise in somatic cells number in the breast milk will be used to confirm the identification. The next we have is acute gangrenous mastitis. Bacteria like Clostridium perfringens and E. coli are directly linked with it. Malnutrition, severe dehydration, anxiety, temperature and toxemia are the few symptoms and can also result in fatality. Initially, the glands appear red, bloated and heated. Third is chronic mastitis. Fibrine lumps, flaking or shredding can be seen in milk. Number of somatic cells in the body increases are the few ways from which you can diagnose chronic mastitis in your cows. Last is clinical mastitis. To diagnose it, you should look for inflammation of the mammary gland or udder area, redness, high temperature, soreness and irritations are few signs. Milk undergoes physical alterations. For instance, you might notice lumps forming in the milk due to fibrine. Mastitis is most commonly spread by frequent interaction with milking equipments as well as through infected hands or object. Another way is by calves to pass the virus from mouth to the udder. When calves are fed milk, a mastitis causing bacterium may be generated into the calf's mouth cavity, where it will remain latent until it has been passed further. Few ways of diagnosing mastitis are fore-milking. The best way for diagnosing most initial occurrences of clinical mastitis is to remove milk from a cow and examine it. This is due to the fact that alterations in milk are frequently the first indicator of mastitis. When milk is spilled on a black surface, clumps, flakes and color or texture changes might be noticed. Clots and flaking are more prominent in mastitis in cows. The other method to find it is measurement of somatic cell counts. One of the most effective approaches to detect subclinical mastitis is to measure somatic cell counts, that is SCC. White blood cells, termed leukocytes, make up the majority of somatic cells, which arise in reaction to the bacteria causing mastitis in cows. The amount of somatic cells as per milliliter of dairy is used to calculate SCC. The higher the SCC, the more serious the infection is considered. Like humans, cattle and other animals also need regular checkups to be safe from diseases. As I said, it's a curable disease, but in some cases, it can be fatal too. Let's see what prevention and treatment methods are available till date. Prevention includes things which we can do or perform to keep our cows healthy, like using a pre-milking udder drop or sprayer and cleaning udder dryer before milking. After pumping, wipe the mammary gland once more to eliminate any microbial activity, medium. And last but most important, keeping the milking environment clean other than prevention. When the situation worsens, the treatment methods are available. you have to directly go to the veterinary doctor. Giving antibiotics, these can be given in the form of an injection and pumped inward with teat canal. Mastitis vaccines can be given to stop the further damage and lessen the infection. Other medication which I use to relieve cattle from pain are NSAIDs. This stands for non-steroidal anti-inflammatory drug. These are like aspirins and are more effective as the recovery rate of this medication is higher than antibiotics. We have talked so much about health of cow, diseases and their cures. One question must be arising in everyone's mind. Is it going to affect your business? Yes, you will witness a decrease in the amount of milk production of the diseased cow due to mastitis, as it's very irritating for a cow. And in some cases, it is possible that the decrease in the output is momentary or sometimes it's irreversible. Mastitis in cows can be very dangerous disease and can be chaotic too. In such scenarios, you must understand the pain and discomfort that your cattle are experiencing and empathize with them. Try to give them their space, make them feel most comfortable. Follow the routines your veterinary has advised religiously. Once your cow is healthy again and back to normal, you can continue milking. So, this is Yash Saxena signing off. For more such videos, stay connected with us.